Good evening. Welcome to Clean and Comfort. We're here in part two of public health with Dr. Delia, and Dr. Carr may not be here today, or she may stop in. But Dr. Delia, how are you doing?
Good. Doing very good. Thank you.
We're going to touch again on public health and finish our conversation. For the listeners out there, we're going to touch on what public health is again and why public health is important. Could you refresh us?
Sure. So public health is it's a macro level approach to health. So what I mean by that is it doesn't focus on the individual like patient-provider relationship, like when you have a physician that provides you care. It's different than that. It's about setting up structures and environments that are healthy, that encourage healthy choices, that give people the education and the, like health education, for example, falls under public health. It gives people the information that they need, makes things available to them structurally, and also it should be available from a political perspective too, like from the government. We want to set up the conditions in which people can be healthy and thrive. That's what public health is. And it's really important because we know that if we don't have environments and structures that are conducive to health, it's almost impossible or very, very challenging to make healthy decisions or to behave in a healthy or healthful way. So we have to design the environment and have things available for people to be healthy.
Well, it sounds simple to some, but let's look at it from an even more simplified way. Like, for instance, I am not healthy to begin with. I was born with an underlying conditions or pre-existing condition, and I live in a community, for instance, a community that does not have a good supermarket or a farmer's market close by, so I'm not able to get good, healthy meals daily. How would that affect, how does that relate to public health?
Right. So, yeah, this is a really good example. So we would want to, in public health, make sure that people do have access to and the knowledge that they need to be able to purchase and cook with healthy foods. So sometimes public health can actually involve like zoning, for example, and sometimes it involves it could involve even like cooking lessons, for example, can fall under public health, or sessions with a dietitian, for example. So it depends on, there a lot of different activities fall under public health, but the range goes from like where businesses establish themselves, like a supermarket or a farmer's market, all the way to health education for eating healthy and cooking healthy. So it's a big range. Oh no, did I lose you?
Oh, I'm here.
Sorry.
I said I live in New York, and a politician came on, and he was talking about opening a supermarket. This is 2021, and they were referring to a certain area in Harlem. And the gentleman came on and he said, there is no large supermarket in that district. And I drive through Harlem just about every day, going and coming from work. And I never noticed that there really isn't a supermarket, a large supermarket in that neighborhood. I pass through and I go home to my area where, to be very honest, just thinking about it, I have 1, 2, 3, maybe 4 large supermarkets just in my area. And I live in Westchester. So I know we spoke about the differences of communities and how things are available. And I said, wow, a supermarket in 2021, they're still fighting over that. And I thought about it, and I couldn't wait to ask you how you felt about this today. So how do you feel about 2021? And you mentioned politicians and government and a community not having access to fresh food.
It's a travesty. I mean, it's a structural inequality, and it contributes to health disparities. I can't remember how much we talked about health disparities in the last episode, but that's a big focus of public health. We know that wealthier neighborhoods are more likely to have access to things like farmers markets. And so we know that the way businesses are, or how we access or the inaccess to a business does contribute to health disparities. So I think that it's absolutely the responsibility of politicians to support and to advocate for, and for people to be able to advocate for themselves too, for things like large grocery stores that have, lots of food options in all neighborhoods. It's really, it contributes to health disparities when we don't have that. Health disparities being differences in health, and then there's also health care disparities, differences in access to care by some aspect of social identity. So it could be by socioeconomic status. It could be by race, ethnicity. Those are some of the categories that people experience really discrimination that can result in disparate health outcomes.
Right. I have a friend who is a psychiatrist, and she talks about mental health and mental health in certain types of communities. And how does public health relate to mental health, or how can it?
How can it? Yeah, that's a good question.
Affect mental health.
Right. So I definitely believe that there are inequalities that can contribute to a greater burden of stress and things like that can contribute to a mental health crisis or a mental health issue or condition. So there's a few things that this question makes me think of, but one being that we want to reduce inequalities because we know that stress can contribute to mental health concerns. So we want to make we want to make it so people have access to the resources that they need and access to the care that they need, especially in the case of we want people to have access to mental health care providers, which is a public health issue. So access to providers is a public health issue. And we also want to reduce inequalities and stressors and discrimination, because that can contribute to mental health issue or condition as well.
Right. And even simple things like people who can, participate in mentoring people, mentoring. And if you're able to, if you are fortunate enough to leave a certain community, go back to that community and try to hook up with an old buddy, or hook up with the buddy's friends, or go back to the school you used to go to and volunteer at that school, so you could maybe assist some of the young people that's coming up within that community. Because sometimes really bad communities and children in bad communities with nowhere out will help make a situation even worse if you don't have any assistance within that area.
Right, and I would say definitely in public health we would think that that it would be like a lack of resources and a lack of support. So it's not, there's a need for social support and services, and that that's really the underlying problem, that there's resources missing and that people aren't getting what they need in those situations. They're not getting the help and support and access to services that they need.
Yes. It's an interesting topic. My friends and I, we talk about it a lot. We talk about, mental health, and we talk about the simple things that we take for granted. The simple things we take for granted. And we talk about public health and disparities within certain things. Right there in 125th Street in Harlem, as I say, I drive through Harlem daily. There was a very large supermarket that was on the corner of 125th and Lexington Avenue that closed. And in that area, there is, I don't know if there's another one close by, but I understand that they are going to put a large supermarket in that area. But for years and years and years, there isn't any.
Right.
So you wonder how and why a lot of people have so many issues in that community, and no one is really paying attention. But I thank you in advance and Dr. Carr for what you guys are doing, and especially with your education and educating people that are going out in the field to make sure that everyone is equipped to handle certain circumstances that they face in the real world.
Yeah,
when it comes to health, public health.
Yeah, it's exciting to work in education because it's just nice to think about that a lot more students now are getting a foundation in like approaching health in a macro or structural way, even if they end up choosing to be a more traditional type of healthcare provider, like a nurse or a physician or all different types of healthcare provider. They'll still have that base knowledge in public health, which will be nice because it gives you a unique understanding of the world, I think, and way of looking at health problems. It puts any individual problem it puts it in its context, and you can see some of the factors behind or that contribute to any individual health problem. There's often